Thank you, sir. Good morning. I want to welcome you to the joint CERS-KRS Retiree Health Plan Committee. This is a special meeting on September the 12th. At this time, I'll call the meeting to order. Ms. Bass, would you read our opening statement or legal statement?
Yes, thank you, Mr. Powell. For the record, I want to note that this is a special meeting of the Joint Retiree Health Plan Committee of the Kentucky Retirement System and the County Employees Retirement System. This meeting is being broadcast via video teleconference pursuant to Kentucky Revised Statute Section 61.826 and may be viewed by the public at the Kentucky Public Pensions Authority offices located at 1260 Louisville Road in Frankfort, Kentucky. It is also being broadcast to the public via Facebook. I ask that if you're speaking and not appearing by video, please identify yourself before talking. In the event the video or audio broadcast is interrupted, we will attempt to reestablish a connection. If a connection cannot be reestablished within 30 minutes, the meeting will be adjourned and rescheduled.
Thank you very much. Ms. Rankin, can we have a roll call?
Yes, sir. Mr. Powell,
Here.
Mr. Fulkerson,
Here.
Dr. Miller,
Here.
and Mr. Piercy.
Here.
Thank you.
Thank
And
you.
we have
have any?
no public comment.
All right, thank you. I'm sure everybody remembers, but just want to remind you that this is a special meeting, so the only thing we can discuss is the agenda items, which we are now to, which is the 2024 retiree health monthly contributions, rates, plans, and premiums. This time I'm going to turn it over to Connie Pettyjohn.
Thank you, Mr. Powell. Sherry, could you turn to the next slide, please? Thank you. We wanted to give you a snapshot of what 2023 contribution you voted for last year would look like. So when you voted to set this contribution at the $252 at the 51 cents and make that the premium Medicare Advantage plan contribution and premium, that meant that people who have 240 months of service or more at 100% get the $252.51. And then, as would follow, the individuals who have a service benefit of less than that at 75%, at 50, 25, or 0. People at 0 to 47 months prior to 7103 are allowed to purchase insurance, but they don't have a contribution until they get to the 48 months. So is there any question, because this is what we're going to be looking at throughout. We're going to look at what you voted on September the 5th, and then what you're maybe possibly looking at for today. So any questions how this breakdown is?
Connie, if I can just add a little bit.
Yes, ma'am.
So we wanted to show the monthly contribution rate for 2023. And what we want to point out is that for the members who don't have the 100% paid, like the 75% or the 50%, the amount that KPPA that is paid, they can use that toward any health insurance plan that's offered by KPPA. So that's the amount that they can use to either go with an MA premium plan, the MA essential, or medical only, and so on, so forth. But that's the amount that we would contribute towards whatever the premium of the plan is. And I also, before Connie goes on, sorry, Connie, I just wanted to say, thank you for having the special meeting to discuss some of these next items. We're in a situation where we haven't experienced before in the past. So sorry that it didn't register at the last meeting, but after we were looking at some of the decisions that were made by the committee, it brought to light some of the issues that we'll be showing on the next few slides. So, okay, go ahead, Connie. Thank you.
Okay, Sherry, the next slide, please. And this is going to be slides around the medical only and then the mirror plan. So the medical only plan, if you look at the field names, you've got the percentage of contribution. We do have the number of members, and this is based on the September payroll report of people enrolled in the plans at this time. what it cost them in 2024 when which is what we just showed you. This is they would have still got the contribution, and then 23, and then what you changed it to in 2024. Now, if you look at the asterisk that goes to this contribution you had voted on 9.5 to donate to set the contribution at 93.35. Well, in doing that, the people at 100%, would have the $95.23 to pay to make that $188.73, which is the premium. So if you look at the next row across, you're going to see that still has the asterisk. The red is a cost increase for the retirees. And we modeled you looking at the 2024 contribution being set at $188.73, which is what the medical only plan would have cost. It costs for next year, and looking at what that would do to the contribution based on percentage level and the cost savings, you would see the difference between they still have an increase with some of these, but it's not as much as it is when you set the contribution at the 93.35. Is there questions around that? Have I missed something you think, or? It's just
What does the medical only cost for 2024?
$188.73, the two asterisks down here. So that's what's modeled in the row that says 2024 costs based on medical only per month. So if you set the premium contribution plan at that, then everyone at 100% would be allowed to use the $188.73 towards their premium for any of the plans offered on the by the Medicare plans. And that's what all these slides are going to show, what that change would be to as we go through. So that right there shows what would change on the medical only, which if you look at, what the members' cost is in 2023, you're going to see, the premium back then or this year was $180.14. So it's still, when they get over here, if you change it, you're going to have, less increase, of course, than you would if you left it at the 9.5. But that's actually the decision point or the consideration you're looking at, just to see what that would look at like.
Connie, can I ask a question?
Yes, sir.
Is the reason, so it looks like what I'll call the medical and the essential, what I'm just going to call the alternative plans to the Medicare premium, which is what most people have, correct?
Mm-hmm. Yeah.
Okay, so is the reason that most people choose these, is it because they don't get 100% contribution and they're just trying to make their financial impact as small as possible?
Some of them, yes. Some of them have other drug benefits somewhere else, like the VA or a spouse's retirement plan. Some of them want to choose this plan because they don't want to be in Medicare Advantage, period. So they'll go out and they'll buy their own drug benefit to go with this. And so and then some people want to use this for their spouses, maybe that don't have a lot of drugs or is on a small maintenance drug. They can get a plan that covers just their area for a very low amount. And then this helps them manage their budget with getting their spouse's coverage when it's not paid for and they're non-hazardous. So there's a lot of reasons, but it has went down in membership over the years. Used to back in 2012, somewhere around 5,000. So now we have 3,000 plus. And you're going to see if you try to add the numbers up, the difference is the people in the dollar benefit now that are in this. This people after 7103, there's a percentage of them that just get a flat amount, period. And we do have that slide on the last, but most of these people are looking at, working with other plans, coordinating benefits, or just staying out of Medicare Advantage, or, looking at affordable care comparisons. And it's not a lot of people, as you see, it is not. But the board looked at this several times and, decided to keep this plan because the cost was controlled, or the cost is reasonable. You know, the actuaries look at it and the way it's worked with the benefits, and it's been a premium that the board's felt it's important to offer to the retirees that are interested in this. And we can continue looking at this to see what the interest is and some of those factors, Mr. Thank you for the question. But yeah, it's a different bunch of reasons that they may select this.
So I think it's like 3,000 give or take, and I think I remember Humana saying they projected like 56,000 on their plans this year. So it's probably about 6% of Medicare eligible retirees, give or take. Does that sound right?
Yeah, it's not a large group.
Okay.
Any other questions?
Connie, is this the first time that you can remember that the Medicare only is more expensive than the?
You don't
Than the
normally
standard plan?
have it is a little more expensive every year because cost trends goes up, but this what's happening as a result of the RFP, and we know that the RFP and the way the premiums were guaranteed. We've never had that situation, no, and I don't know that you are going to have it in the future with changes that Medicare is looking at, but we won't know that yet. But it's really an aberration that you have this. Any other questions before I go on to the mirror plans? These are the complicated plans. And remember, the people in these stay small. The purpose of this mirror plan is to allow a person to have time to get Part B when they failed to get Part B to be in the Medicare Advantage plan. Normally, they're on this until they obtain that and with Medicare, and then they will be transitioned into the Medicare Advantage plan, which they chose in the first place. The only other reason they can have a mirror is if they're in the middle of a transplant and or treatment, surgery, other things like that. And in that case, we pay the extra amount. But these plans cost more because you have the medical only premium, because it's pays after original Medicare. Even the medical benefit on these are structured. Plus, you've got the cost of a prescription drug plan. So between the two, it ends up costing more than the MA plan or any contribution you've ever set. So the retiree would have, even at 100% contribution, some sort of a cost. And this year, if you look at the 2023 cost, you see the people at 100% that they had $67.74 because the cost was set at the contribution was set at $252.51. And you can see some of these, that still would leave an amount that they would have to pay because it is, a little bit higher for the mirror plans. And the reason the premium and the essential mirror is different is the drug benefit costs more on the premium plan. So if you look at the 2024 column with the member cost where you set it at $93.35 at 100% contribution, you're going to get someone having to pay out of pocket a month $234.76. And then if you look at the cost increase column for the 2024 as you've currently set it, you see that that went up that much, which just reflects the math for you. And then if you look at 2024, which is based, if you base it on the medical only premium, you'll see that what the member pays does go down, and then the red on the last column will show you the amount that it is increased still. So it would be, for example, instead of the $67.74 in 2023, it's either going to be, it would go down to it would go up a little to $71.64. And that has happened before with the way this mirror plan works for retirees like this, because the Part B, Medicare Advantage is much cheaper than offering original Medicare and a supplement after it. Any questions on how the mirror plan operates or how this would impact that? If not, let's go on to the essential and you'll see why it's a much different picture. Well, not much. I mean, it is a lower cost on because it has the lesser drug plan, but It does offer the standard Medicare drug plan benefit, which you all have, set the deductible at a lower cost than even Medicare. So it is very, I think a cost effective for the people that need to be in this. And it does provide the drug coverage that they would want. And instead of being, if you go with the cost you did on 9.5, you'll see that 100% they have the 135.63, which would be, that's a cost increase on the essential last year because it was set at, because of the contribution of 252.51, there was able to, the trust paid more and the member paid a little bit less. And then if you change it to the medical only premium, which is the second asterisk down here, then you're going to see that the member is going to have $40.25 at 100% contribution, which is still a cost increase, but not as much as it was. To have would be at set at 9.5 rates that you voted on. Any questions around the essential? And again, you have 29 people in this plan, and some of them will stay on, very few stay on it, but most of them roll off into the Medicare Advantage plan when they get Part B. If I don't have any
And just to
questions.
clarify that, that's just literally just 25, 26 people. It's it's very small. It wasn't 2,500 or 26, it's 25 or 26.
Okay. Sherry, I think the next section, we're going to start with the Medicare Advantage plans. So we'll start right with the Medicare Advantage premium plan. If you look at 2023, you'll see the 252.51, it's the contribution there. What's what they pay if they don't have any benefit, they'll pay that cost. So the 2024 cost, would be, it was set at the 93.35. Well, if you look at the cost increase bucket next to that, most of those are green. That would be cost savings to the member. You go over to look at what the medical only premium contribution would, if it was set at that, what it would do, you have much less out-of-pocket cost, and then the cost savings is all in the green, well, except for the 0, but all in the green there. So
Yeah, and if I may,
yes,
just
certainly.
point out, if it was set at the medical only rate, the 188.73, for anyone who has 50% or more contributed towards their health insurance, there would be no cost to them.
Yeah. Any questions about the premium plan? Okay, the essential plan, this is the one that it's going to be the same cost savings. Because the premium is $4.07 and it was $75.56 last year. That's what the contribution was set by the committee and the board. So, and that's a little bit larger amount of people, as you can see, that, we're getting into the MA plan. So, is there any questions around the essential plan? If not, the last is the dollar. And this is a non-hazardous example. That this is just an illustration of an example of what someone who has 10 years on the dollar contribution, because right now it's they get $14 and I think that's $14.10 as a monthly contribution. It goes up 1.5% every July. That's per statute. And then they would get that amount starting July 1 every year, going up a little. So that meant they would get more for their benefit to use towards a plan. So this is also the group that can now go out on the open market, and we would provide the reimbursement if they want to use their benefit to purchase a plan for themselves on the individual marketplace or individual market for Medicare. So this shows that basically, just like I said, they get a contribution, and you don't have, the contribution is calculated, so you do not have to set this premium for them at all. It's for the people hired 7103 or after. Any questions around their contribution? And this cost here is calculated on the 93 only, the 9335, I believe. Well, it's not, sorry, that's confusing.
Yeah, I was gonna say, I don't think the
There
monthly
is, it doesn't apply
contribution
here.
for the percentage doesn't
it
apply
doesn't.
to these people
just-
because
yeah.
they just get the dollar amount, and that is applied to any plan that they elect to
Yeah.
have coverage in, any of the KPPA plans.
And then the other caveat, there's another note down below. After September 108, they've got to have a minimum of 180 months to even start having to be eligible for insurance. So that's a little different. I believe that's all the slides, isn't it? Yeah, it's slide 12. So if anybody has any questions, please let me know. Do we want to look at anything else?
So basically, we're needing to figure out what we need to do with the mirror plans and all that. Do we want to retain that rate, change it, or would you want this applied across the board? Or
Yes, I think we wanted to provide all of the information so that you would have all of those details in order to finalize what you want for the Medicare plans, the monthly contribution rate, and the monthly or in the contribution plan.
Siri, go back to slide 3, I think it is, the medical, just right, yeah, right there, the medical only. One more down, I think, or 2 more down. I'm wrong. 5. Yeah.
so
So
what's the committee's? Go ahead, Connie. I'm sorry.
I was just going to say, you currently have the contribution based on the premium plan at 93.35 cents. Do you want to consider continuing that, or look at the contribution, base it on the medical only plan at 188.73?
Does anybody have a recommendation?
To me, that makes, I think we've looked at this, and Abby Sutherland and Aaron have looked at the options. I think this seems to be the best option to look at the entire group of retirees and come up with a reasonable alternative to.
I think what Connie is saying is, when we've looked at it, is that from our perspective in looking at the numbers in the groups, that we think that our recommendation would be to set the contribution, monthly contribution rate at the medical only premium amount, which is the 188, and set the contribution plan to be the medical only.
Great, thank you. I like that recommendation.
It's probably really our best solution. The shame of it is, I think what we did was actually the right thing for the vast majority. But unfortunately, the unintended consequence of really harming the small minority it probably outweighs that. So yeah, I think that's probably the thing to do, to just set the contribution to 188.73. Hopefully this thing will heal itself in time and we won't have this disparity going forward. So Jerry, if you're looking for a motion, I'll make a motion to set the contribution rate based on the medical only plan, 188.73.
I second that motion.
I have a first and a second. We have any more discussion? Dr. Miller, do you have any thoughts you wish to share? Particularly since this is your area of expertise.
I'm good.
Okay. All right, then we have a first and second. Being no further discussion, we'll call for a vote and that we set the members' contribution rate based on the medical only plan of 188.73. All in favor, say aye. Wait your turn,
Sorry.
Jim Tony. Okay. All in favor, ayes?
Aye.
Aye.
Okay.
All right, thank you. Any opposed? Motion carries. Thank you. And that's all we have for that on our discussion of that. Is that correct, Connie?
Yes, sir.
And since this is a special meeting, we can't discuss other issues. So going to break from format a little bit here and take a motion to adjourn since it's special.
So moved.
Have
Second.
first and a second. All in favor, say aye.
Aye.
Motion carries. We are adjourned.